Family Health Options Kenya is a registered volunteer-based non-government organization in Kenya. Since its inception in 1957, Family Health Options Kenya has been in the forefront in promoting sexual and reproductive health services.
We are a non-government organization, a national non-government organization. We work in 7 out of the 8 provinces in Kenya. We work in 5 areas in particular. The area of HIV, AIDS, the area of advocacy, the area of adolescents, and the area of abortion. We also run 9 clinics, which are based in all parts of the country except Northeastern. The 9 clinics provide comprehensive SRH services. Out of the 9 clinics, we have 2 which provide maternity services. That's our Nairobi West Clinic and the Eldoret Clinic. We also run 7 youth centers, which are based in almost all parts of the country, where young people access comprehensive SRH services, which are youth-friendly. We also have a strategic plan, and within the strategic plan, all the 5 A's are covered, where we have the A of AIDS. That's where we have the Japan Trust Fund. So in the strategic plan, the A of AIDS basically looks at the reduction of HIV and AIDS infection and the protection of human rights for those having HIV.
Family Health Options Kenya, with the assistance of Japan Trust Fund, implemented a project entitled Integrating HIV Prevention for Women and Men in Nakuru District.
When we look at our Kenya AIDS Indicator Survey of 2007, the national HIV prevalence was 7.4%, of course with regional variations. Rift Valley and Nyanza had 7% HIV prevalence. And out of the 1.4 million Kenyans who are HIV positive, Nyanza and Rift Valley host almost half of those HIV positive adults. And that is one of the reasons why we decided to focus on Nakuru, which is one of the districts in Rift Valley province.
Limited interventions were in place in Nakuru district to address the needs of people living with HIV, and the few that existed did not have a structured mechanism deliberately designed to meet the sexual reproductive health services and needs of people living with HIV.
We felt it was important to have this project because initially there were interventions which were there, but those interventions were not really addressing the needs of people living with HIV. And we realized that people living with HIV are the people who are in control of reducing new infections.
The objective of the Positive Prevention Project was to promote HIV prevention and to promote positive prevention among people living with HIV.
When we want to focus on reduction of HIV new infections, then we thought it would be better to address the needs of people living with HIV.
Interventions entailed providing services aimed at protecting their sexual health, avoiding other sexually transmitted infections, delaying HIV and AIDS disease progression, and avoiding transmitting HIV to others.
We had 4 main interventions we wanted to put in place. One is to protect the sexuality of people living with HIV. And to protect their sexuality, one is for them to use or adapt a family planning method to use. And 2, we did investigations to prevent cancers like cancer of the cervix, cancer of the breast. So we could screen them so that they could live healthy lives. That's one important intervention we put in place for people living positively with HIV. The second intervention was avoiding sexually transmitted infections and other opportunistic infections. So we could regularly screen them and also offer prophylaxis or offer drugs which can prevent other opportunistic infections. The third one was to reduce progression of people of HIV. You know, from HIV they develop AIDS, they become more sick. So to reduce that progression, we offer the ARVs, that means drugs, And in ARVs, we train them on adherence counseling so that they can adhere to use the drugs. We also train them to prevent infecting their children, that is a prevention from mother to child, so that they cannot be able to transmit the infection to their children. The fourth intervention was to reduce transmission to their partners and others. That means they were to have safe sex. You know the ABC of safe sex, that is either abstinence or being faithful, and mainly using condoms, because we take use of condoms as prevention of transmission of HIV.
Before the intervention of the Japan Trust Fund project, the beneficiaries lived hopeless and miserable lives.
Maisha yangu before niingie kwa hii mradi ilikuwa mbaya juu hata watoto wangu hawakuwa naenda shule.
Nilikuwa chini sana, hata singeweza kuzungumza ninavyozungumza hivi. Mwanzo nilikuwa na ile stigma na nilikuwa nimejikataa. Madawa sikuwa nimeshaanza kumeza. Nilianza kumeza baada ya kujiunga na project yenyewe.
Sikuwa na kitu yenye naweza kula kwa nyumba, hata kutembea singeweza. Wenye watoto wangu wangekuwa hata kitu wakiitisha singepata ya kuwasaidia naye.
It was a life full of dejection, pain and tears.
By the time nilikuwa tu na biashara, lakini ilikuwa inaenda chini juu saa ingine nafanya, saa ingine mwili inakataa. Sasa saa ingine napiga korogoro moja ya juu, nauza, tunakula, hata inaisha. Saa ingine hata ninajikuta naenda kukopa njugu ndio nipike. Yaani maisha ilikuwa ngumu sana. Sometimes hata mpati chakula ya kushiba, nyumba ni ya kukomboa, landlord anakusumbua, huna pesa, mwili ndio hiyo inakusumbua. Watoto hawana raha. Watoto wananiangalia tu wanaona kama naisha. Yaani na hofu mingi sana.
Kabla mama join FPAC, maisha ilikuwa ngumu. Alikuwa anagonjeka sana.
The beneficiaries encountered various challenges, many of which they overcame through the project.
Vile niliingia sasa nikaanza kumeza madawa, kukula vizuri, na nikakaa sana juu sikuwa na ile nguvu ya kuwaambia iliendaje ama haji. Lakini vile nilifundishwa, nilipata hata kuwa diskusia, nikawaambia vile iko. Na wakaweza kunishika vizuri na tukaendelea na maisha.
Maisha yangu before niingie kwa hii mradi ilikuwa mbaya juu hata watoto wangu hawakuwa naenda shule. Walikuwa nyumbani, walikuwa wanafukuzwa kila wakati, wanakuja nyumbani. Lakini wakati niliingia kwa mradi mpaka saa hii, hata kuna mtoto nilipeleka ako form 3, first born wangu.
Baby Jesus, baby Jesus, I love you, I love you.
The Positive Prevention Project has been a great success since it not only improved behavior change but also economic status of the participants.
Mradi umenisaidia juu tangu nijiunge na hii mradi, watoto wamekuwa wakienda shule kama wamefuatilia, kama ni hiyo pesa inatakiana ya mtihani huwa ninapata. Zamani nilikuwa nakosa, hata nawaambia kaeni hapa, tulikuwa tunakaa hata nyumbani. Sasa hivi hata huna mbele wala nyuma, hata hakuna mahali unategemea. Lakini tangu nianze huu mradi umenipa maisha mpya. Nilipoingia nimefaidika sana juu walinifundisha how to fight stigma, na nilipoweza kufight hiyo stigma nikaona hata afya yangu inarudi juu.
Hii mradi ilinisaidia kuanzisha biashara ya samaki. Watoto wangu singeweza kitu naweza wapikia hata niweke mbele yao ya kukula, na singeweza hata vitu za shule. Ikitakikana shule singeweza kutoa. Sasa wenye walinisaidia na hiyo pesa ya biashara nikaanza. Sasa sasa naona watoto wangu hawezi kosa kitu.
The support group was a perfect forum where members shared their challenges and experiences.
Kila mara tunapokuja kwa support group, kuna vile huwa tunaulizwa changamoto Iwapo unanyamaza sana, unaonekana tu straight, wewe una stigma. Kuna ile counseling, kuna mashauri ambayo mtu hupewa. Hata daktari anaweza kukuita, anakushauri. Kuna members wengine wa group, kuna Jane hapo.
As much as we may want to keep our HIV status within us, lazima tutafute mtu mmoja yule mwenye tunaamini.
Members of the forum were trained in detergent making as an income-generating activity, thus engaging those who did not have a source of income.
All the members were trained on detergent production, which they make at the support group level, and every member is also allowed to make this as their own IGO back at home in the different communities where they live, where they can also sell, prepare the detergent and sell, and help them in sustaining their own families. All the clinics within Kenya, which are run by Family Health Options Kenya, were buying this detergent from our support group, and thus the support group members have their savings, which they can use in developing themselves.
It is evident that the project instilled into the members long-lasting social values.
Ile faida ninaweza sema ya muhimu zaidi kutokana na hii project ni afya, kuimarika kwa afya yangu. Manake mwanzoni sikudhani nitawahi kuwa hivi. La pili, ninaweza kusimama mbele ya watu na kusema nina ile confidence. Nimeweza kujua madawa yanafuatwa na nimeweza pia kuwashauri wengine kule vijijini. Sasa hapo na nimeweza kuwa mwalimu wa rika, educator. Hayo manufaa yote nimeyapata kutokana na hii project.
Kwa huu mradi ya kwanza nimepata mafundisho, nikaweza kujikubali, nikaweza kukaa vile nilivyo na kujikubali. Jukaa singejikubali singekuwa. Na umenisaidia hata na niseme hata kujidharau, nilikuwa najidharau sana. Sasa najionaga niko wa muhimu katika hata community. Hii mradi umenisaidia, singeweza kujitambulisha, hata singeweza kusema kuhusu nini yangu, afya yangu.
Family Health wamenisaidia, wamenitia nguvu. Sasa niko na nguvu, naweza simama hata mbele ya watu na niseme mimi ninaishi na virusi.
Family Health Options Kenya also partnered with community leaders and the relevant government departments to generate support for HIV prevention and positive prevention services.
What we've done in the district is that we've really tried to identify people who have been infected with HIV through the home-based care program. And once we get people who have been infected, we have tried to educate them so that they can also participate in prevention with positives, so that they cannot spread the HIV virus also.
We have been encouraging those who are living with HIV and AIDS to form groups where they are taught how to live positively and to engage in income generating activities. I've actually been coordinating those activities, and not only the public health sector, even other interested parties who come on board to request that they be given a chance to talk to those people living with HIV and AIDS.
The young women and men in Nakuru district remain particularly vulnerable to HIV infection due to a myriad of factors.
What we are seeing in our municipality is the nature of jobs that people are doing. We have flower farms around, we have the highway passing along, so we have truck drivers also along the town at certain stops along the highway. So this is really contributing. There's a lot of poverty is in the increase, so this has contributed to the high prevalence.
Following the successful implementation of the initial project, there is need to reach out to more people in Nakuru district and expand the positive prevention project to the other counties. With the overall aim of reducing HIV prevalence rate, this will ensure sustained behavior change and promote positive living among communities.
This was a 2-year project that I would have said, I say that really has changed the lives of people living with HIV, because many of them attested to the fact that the project has really changed their lives in terms of health as well as economic empowerment.